హాయ్, గుడ్ మార్నింగ్ ఫ్రెండ్స్. ఈరోజు నేను కరోనా వైరస్ డిసీజ్ గురించి ఎక్స్ప్లెయిన్ చేయాలి అనుకుంటున్నాను. ఈ వీడియో కనుక మీకు నచ్చినట్లయితే ప్లీజ్ లైక్, షేర్ అండ్ సబ్స్క్రైబ్ టు అవర్ ఛానల్. వీడియోలోకి వెళ్ళే ముందు ఒకసారి నా ఛానల్లో ఉన్న వీడియోస్ అన్నీ చూడండి. మీకు నచ్చినట్లయితే సబ్స్క్రైబ్ చేయండి. థ్యాంక్ యూ ఫ్రెండ్స్. Today we are discussed about COVID-19. COVID-19 is a contagious disease. Contagious disease means transmitted from one person to another person is called as contagious disease. Contagious diseases are two types: direct transmission and indirect transmission. Direct transmission examples are droplet, airborne, pomade-borne infections. Indirect transmission examples are droplet. For example, we have to take in pencil from your friend, they transmit your friend pencil to you. This is called indirect transmission. Causative organism of COVID-19 is SARS-CoV-2, meaning severe acute respiratory syndrome COVID-2. Full form of COVID-19 is coronavirus disease 2019. Then it is called as COVID-19. First detected in Wuhan, China on 1st December 2019. 31st December 2019, pneumonia with unknown etiology, means there is no etiology, then it is called as pneumonia. Novel coronavirus name is 7 John 2020. 13 John 2020 apart from China in Thailand. Apart from Thailand, WHO declared as COVID-19 in 11th February 2020. In India, reported first case of COVID-19 in 30 John 2020. 11th March 2020, WHO declared as world pandemic. World pandemic is a phase 6. There are 6 phases are present in COVID-19. Those are COVID-19 phase 1, phase 2, phase 3, phase 4, phase 5, phase 6. Those are discussed in later topic. Community transmission of COVID-19 are seen in 4th phase, country lockdown, but later in pandemic worldwide is that, but 25th March 2020 is worldwide pandemic, that is called as first lockdown. First vaccination 16 John 2021. Vaccinations are Covaxin, Covishield, those are given to ours. Now discussed about structure of the COVID-19. This is called as nucleocapsid. This is called as spike glycoprotein. This is called as membrane protein. This is called as envelope. This is called as RNA. This is called as hemagglutinin esterase dimer. In this structure, main important is spike glycoprotein. This spike glycoprotein directly enters into the lungs, binds with the type 2 pneumocyte. Then it releases the RNA. RNA releases the ATP. This is called as transpiration. In easy way, we have to remember SMEN. S means spike glycoprotein, M means membrane protein, E means envelope, N means nucleopeptide. Common characteristics of COVID-19 patients means DAD full form is diffuse alveolar damage. In lungs, alveolar is main part. Those alveolar are damaged mainly due to COVID-19. Diagnosis, first we have go for RAT. RAT means rapid active test. We have to done the RAT, this is negative. Then we have go to RT-PCR. RT-PCR also negative. RT-PCR means reverse transcript polymerase chain reaction. This is the most reliable test and also efficiency and most correct figure is came. Then RT-PCR is negative. Then we have go for serological test. Then final result came negative. We have COVID-19 is negative. We have done the RAT. They give positive result, then we have go for RT-PCR, they are also positive, then we have no need to confirm other tests because this gives positive result. It is called as diagnosis of COVID-19. Biological test is a test for COVID-19. It detects the positive organisms of COVID-19 in previous infections also confirmed in this test. Then we are go for signs and symptoms. There are 3 stages are present: stage 1, stage 2, stage 3. Stage 1 is also known as mild predominal phase. Symptoms are fever, nausea, malaise, headache. Flu-like symptoms also present. Stage 2. Stage 2 is also known as moderate or pulmonary phase. Those are dyspnea, hypoxia, SpO2 are greater than or less than 93. Dyspnea means difficulty in breathing. Hypoxia means shortness of oxygen levels. Respiratory rate are also more than 30 beats per minute. Then we have go for laboratory investigations. X-ray, then bilateral infiltrations are shown. In CT scan, ground glass like symptoms are appeared. And third stage is also known as hyperinflammatory stages. In this we have to see in the ARDS, multiple organ failure, septic shock, hypercoagulability stage. Then it increases the dimer more than 1000. Then we are discussed about phases of pandemic COVID-19. Phase 1, no animal to human transmission. For example, animal have COVID-19 but not transmitted to humans. This is called as phase 1. In phase 2, some of human cases identify. Yes, it is correct. Phase 3, humans to human directly transmitted but not to community. For example, your friend is COVID-19, who had neighbored to him, then we have also came to COVID. Phase 4, community transmission means we are in one street, your friend is in another street, we have go for that street, it transmitted you and then come to your community, it also transmitted overall community. It is called phase 4. Phase 5, 2 countries are continent affected with the some disease. For example, in our country is COVID-19, one person go for another country, it transmitted from this to that. It is called as phase 5. Phase 6, country of 2 continent effects with the same disease. For example, China and India affected with COVID, both are pandemic. Those are all the topic of COVID-19. Ee video